Hi everyone, Dr. Solmaz here. I hope that you're all doing well and staying safe. Today I wanted to take a moment and talk to you about a topic that comes up with my patients on a regular basis, and that is the topic of omega-3 fatty acids and fish. So a lot of times my patients will ask me questions like, Dr. Solmaz, how much fish is too much fish? Or which fish should I be focusing on? Or what's so great about these omega-3 fatty acids anyway? So I wanted to address that. And also I thought that this would be a helpful topic because omega-3 fatty acids are known for their immune boosting properties. And that's important year round, but specifically now because we're in the middle of this pandemic and everyone, is interested in what sorts of foods are helpful for boosting immunity. So let's get to it. Omega-3 fatty acids have been heavily researched, and they have been found to have a whole host of health benefits. They're really extraordinary. So not only do they help fight depression and anxiety, they help promote brain health in pregnancy and in the early years. They also help fight off certain types of cancers. They help fight off autoimmune diseases. They help fight inflammation. And what I wanted to focus on today is their role in heart health. It's really amazing. They help reduce the risk factors that are implicated in heart disease. And they do that from so many different angles. So I wanted to summarize that for you. So how they do that is first by lowering triglycerides. Next, they boost HDL, which is high density lipoprotein. That is your good cholesterol. That is the cholesterol that comes in and cleans out the bad cholesterol. They also help promote heart health by lowering blood pressure in people with hypertension or high blood pressure. They also help prevent platelets from clumping together, hence preventing clot formation. And they also help prevent plaque formation, plaque buildup. That is what causes the arteries to become clogged, blood flow to become compromised, specifically in your coronary arteries, and not allowing blood to flow through to the heart, leading to heart attack. So that is extraordinary. And they also help lower inflammation. Okay. So the question that comes up often is, how much fish is too much, or is fish safe? So the safety of fish is regulated by two bodies. One is the FDA, one is the EPA. Okay. And fish do contain significant levels of certain toxic substances like methylmercury, like dioxin, like PCBs. And we have to be extra vigilant in certain populations when we're making recommendations to patients about fish consumption. And those populations are specifically pregnant women, lactating women, and children. Okay. But typically in individuals who are postmenopausal females, and then your middle-aged and older men, the benefit of fish consumption typically far outweighs the risks, okay? Now that brings me to what fish should we be focusing on specifically. So fish that are rich in omega-3 fatty acids, I tell my patients the fish that you wanna focus on are things like wild salmon, things like anchovies, sardines, herring, and canned light tuna, okay? The fish that you really want to avoid are fish that, when I say avoid, you can enjoy them like once a month, or, really it's better to steer clear as much as possible, but you can enjoy them in a very infrequent basis. Things like shark, things like swordfish, things like king mackerel, these are fish that you generally want to avoid. So now how often do you want to have the fish on the good list, I should say? Things like your wild salmon. You want to enjoy a good omega-3 rich fish 2 servings a week. And when I talk about a serving is just 1 card deck's worth of fish. So 2 card decks worth of fish a week would be a very good amount of omega-3 rich fatty acid fish to enjoy each week. It's important to note that, yes, you can get omega-3 fatty acids from a supplement, but when my patients ask me, I always say it's best to get it from the source itself. So from the fish itself, it's a high quality source always supersedes the supplement, in my opinion, when it comes to omega-3 fatty acids. Now, if you are at an individual who's at higher risk, like let's say you have very high triglycerides, or let's say that you have had a heart attack in the past, you are in a higher risk category, it is very important that you speak with your primary care doctor about, the role of omega-3 fatty acid supplementation, because that might be something that would be right for you. That is my summary on omega-3s and fish. I hope that you found it helpful. And if you did, please share the video to increase awareness. There's so much information out in the internet and in the world. And it's, to spread awareness and, to help somebody who could benefit from this video. So I hope that you continue to stay well, and I'm looking to sharing more with you in the future. Take care.